Assalamualaikum warahmatullahi wabarakatuh. Good morning, Miss Rena, and good morning, everyone. Let me introduce myself. My name is Devina Auriyansah with name P1337420623011. Today I will present about vital signs, which are basic but very important assessment in healthcare. What is TTV? Okay, this is the definition of vital signs. Vital signs check area a basic procedure for healthcare teams and healthcare service aimed at detecting abnormalities, disorder, change in organ function, and other medical problem to assist doctor in making a diagnosis. So, even though the procedure looks simple, vital signs can show early warning signs of serious condition such as infection, heart problem, or respiratory failure. Okay, this is the key vital signs component. First, there is blood pressure, second, heart rate, the third, respiratory rate, and the fourth, body temperature. These four components represent the main function of the body: circulation, heart activity, breathing, and the metabolism. Okay, this blood pressure. Blood pressure can be measured using a tensiometer and stethoscope through systolic and diastolic values. What is systolic pressure? Systolic pressure is the artery blood pressure when the heart contracts and the pump blood throughout the body. What is diastolic pressure? Diastolic pressure is the lowest pressure in the arteries, when the heart must relax or rest between heartbeats. In this space, the heart travels with blood before the next pump. Okay, this is the normal blood pressure values. Blood pressure classification according to WHO. The following is the blood pressure classification according to the WHO. Okay, the first is normal. Normal blood pressure according to the WHO is less than or equal to 120 per 80 mmHg or millimeter of mercury. Okay, the second is prehypertension. Blood pressure can reach prehypertension if the number are above 120 per 80 mmHg to 139 per 89 mmHg. Okay, the third, hypertension. Blood pressure is considered hypertension if the number are above 140 per 90 mmHg or millimeter of mercury. Blood pressure consists of systolic and diastolic pressure. If blood pressure is too high, it can lead to stroke or heart disease. If it is too low, it may cause shock or decrease organ perfusion. So, monitoring blood pressure is very important in clinical practice. And prehypertension is important because it is a warning stage. If not controlled with lifestyle change, it can develop into hypertension. Okay, the second is pulse. Pulse measurement can be taken at the first pulse, located along the radial bone, often used routinely and easier to feel at the wrist and in the line with the thumb. And the second, brachial artery, located in the medial crease of the inner elbow, used with a stethoscope to measure blood pressure. And the third is carotid artery, one of the major arteries located on the neck near our earlobe. The radial pulse is most commonly used because it is easy to access and comfortable for the patient. The carotid pulse is usually checked in emergency situations like cardiac arrest. And here is a table of normal heart rate by age. Normal heart rate by age group, minimum, maximum, and average. Newborn, minimum 100, maximum 180, average 140. 1 month until 1 years, minimum 18, maximum 160, average 120. 1 years until 3 years, minimum 18, maximum 130, and average 105. 3 years until 6 years, the minimum 80, the maximum 120, and average 100. 6 years until 12 years, the minimum 65, the maximum 100, average 83. 12 years until 18 years, the minimum 60, the maximum 90, and the average 85. 19 years until 69 years, the minimum 60, the maximum 100, and the average 80. And more than 70 years, the minimum heart rate 60 and the maximum 100 and average 80. Okay, the third is respiratory rate or RR. When measuring vital signs, nurses will measure breathing intensity in units of time per minute, namely in intensity of chest movement during inspiration, breathing in, or expiration, breathing out. This method aims to assess whether there are difficulties in breathing. And here is a table of normal respiratory rate by age. The first column is age group, the second column is frequency, breaths per minute. Newborn 35 until 40. Infant 6 months 30 until 50. Toddler 2 years 25 until 32, and the children 20 until 30. Adolescents 16 until 19. Adult 12 until 20. Children normally breathe faster than adults because their metabolism is higher. That is why age is very important when interpreting vital signs. Okay, this is the last point of vital signs is body temperature. Temperature is a measure of heat using a device called a thermometer, and the temperature produced depends of the activity performed, the weather, additional metabolism due to hormonal influences, fluid consumption, and gender. Normal body temperature according to World Health Organization (WHO) 36.5 degrees Celsius until 37.5 degrees Celsius is normal. Temperature can be affected by physical activity, hormonal changes, environment, and hydration status. So, nurses must consider the patient condition before interpreting the result. And here is a classification of fever. There are three types: is febrile, hyperthermia, and hyperpyrexia. Said to be febrile if the number is 37.5 degrees Celsius until 38.5 degrees Celsius. Hyperthermia said to be hyperthermia if the number is 38.6 degrees Celsius until 40 degrees Celsius. And hyperpyrexia, said to be hyperpyrexia if the number is more than 40 degrees Celsius. In conclusion, vital signs are essential indicator of a patient health condition. By monitoring vital signs regularly, nurses can detect problems early, prevent complications, and improve patient outcomes. So, even though it is basic, vital signs assessment is a very critical nursing skill. Thank you for your attention. I hope this presentation helped you understand the importance of vital signs in healthcare practice. Wassalamualaikum warahmatullahi wabarakatuh. Goodbye.